Your Lungs and Diving by Dr. Jack Mankies, performed by Dr. Frans Cronje. Diving affects lung function, and several lung conditions may be a contraindication to diving. As such, we visit the aspects of your lungs that are relevant to diving fitness and why abnormal lung function may present a reason for disqualification. It's a well-known fact that the respiratory system of a diver is strained during diving. Humans are dependent on their lungs for survival, and it's important for divers to know the limitations in pulmonary function related to diving. Probably the most important function of the lungs is to facilitate gas exchange, taking up oxygen and eliminating carbon dioxide. Carbon dioxide, when it comes into contact with blood, is converted to carbonic acid, similar to what you get in a fizzy drink. And then, when it returns to the lungs, it's converted to gaseous CO2, which is exhaled. In response to this flux of CO2 in and out, there's a change in the blood acidity, or pH. And so, CO2 and breathing plays a very important role in regulating body acidity. Under the conditions experienced at 1 atmosphere breathing air, the ability to take up oxygen and eliminate CO2 is well matched, but a diver has several disadvantages and a number of reasons why the oxygen-carbon dioxide balance may become disturbed. I'll list them first and then discuss them in greater detail. The density of breathing gas increases with depth. Immersion affects the function of the lungs. There's altered regulation of breathing in water. Diving equipment adds dead space. Divers may follow poor diving procedures, called skip breathing. Gas may be contaminated. Rebreathing may occur of exhaled gas, and some individuals tend to retain higher levels of carbon dioxide than others. So let's start with increased gas density. As a diver descends in the water column, the gas that is supplied to the diver needs to be compressed to allow the person to continue breathing. And so more molecules of gas are contained in the same volume to maintain what we call minute ventilation. The increased density causes the gas to become more sticky, or in scientific terms, it increases the viscosity of the gas, which means it's harder to breathe. And in practical terms, at a depth of 30 meters at 4 atmospheres, the effect of gas density produces a doubling of the work of breathing. Effects of being immersed. When diving, the combination of weightlessness and immersion results in a return of an additional 700 milliliters from the periphery into the circulation. This places a load on the heart and makes the lungs stiffer, which means that the effectiveness of the lungs to exchange gases is somewhat impaired. There's also, particularly if the water is cold, peripheral vasoconstriction, which again means that there is less circulating volume in terms of blood vessels to circulating fluid. Altered regulation of breathing. Studies have found that divers respond differently to the underwater breathing environment. Some increase their rate of breathing, while others tolerate a higher CO2 level. This may have significant implications based on the breathing system and the level of work the diver performs. Rebreathing. Several diving systems, called rebreathers, scrub CO2 from the exhaled gas and reintroduce it into the breathing loop. For a variety of reasons, the chemical scrubbing agents may fail, either because they are chemically exhausted or because the way in which they packed or put and aligned into the breathing circuit may make them inefficient. As a result, CO2 may gradually build up, resulting in hypercapnia. Hypercapnia usually manifests through the experience of breathlessness and a tendency to panic, but not always. And sometimes people may develop dangerously high CO2 levels and ultimately even lose consciousness or have seizures without realizing that they were at risk. CO2 retainers. Some individuals are relatively insensitive to CO2 levels, and therefore their levels may rise appreciably before them adjusting their breathing patterns physiologically. Increased dead space. The word dead space is applied to areas where there is ventilation, in other words flow of gas, but no gas exchange. We know that gas exchange only occurs within the terminal bronchioles and alveoli. The rest of the airway passages do not permit gas exchange. They are simply piping. As such, these represent dead space. Gas simply flows through them. If this gas space increases, then the volume that needs to be exchanged to allow the alveoli to get a refreshing of gas content is increased. Under normal conditions, people breathe about 500 milliliters or half a liter with every breath. This is called tidal volume. As one increases dead space, so the tidal volume needs to increase by approximately the same amount. So in practical terms, if you're breathing 500 milliliters at rest and then add a snorkel with an internal or dead space volume of 250 mils, it means that you would now need to breathe at least 750 mils per breath. And so it can be seen as the work of breathing and the rate of breathing has to increase to adjust to exercise, that ultimately dead space can impair a person's maximum exercise performance and gas exchange. Poor diving procedures. Some divers try to artificially extend their compressed gas sources underwater by skip breathing. This is the practice of essentially restraining breathing efforts and thereby allowing carbon dioxide to increase. It sometimes happens deliberately, but often happens unconsciously as divers simply try artificially to lower their rate of breathing. Divers who skip breathe often complain of throbbing headaches after diving, increased nausea and seasickness, and increased tiredness after diving. The practice of skip breathing is not encouraged. Lastly, gas contamination. When most divers talk about gas contamination, they tend to think of carbon monoxide. However, carbon dioxide is also a very significant pollutant, and if the levels are increased in the gas-breathing mixture, then it will become less efficient for gas exchange to occur, and the work of breathing and the possibility of CO2 buildup would be greater. In conclusion, hypercapnia, or elevated CO2, is typically a far greater risk when diving than oxygen deprivation. Unless the oxygen in the breathing mixture is reduced, as may happen in technical diving, the PO2 is always much greater than it is at 1 atmosphere breathing air. However, CO2 levels may rise for the variety of reasons we mentioned earlier. As such, divers need to be aware to maintain adequate breathing and to avoid skip breathing habits. Also, if headaches or nausea occur while underwater, CO2 should always be suspected. We recommend that divers don't focus on limiting their breathing underwater, but instead optimize their trim and reduce their level of activity to reduce the amount of CO2 they produce. In addition, take regular deep breaths to eliminate any excess CO2, and during the safety stops, take it easy and eliminate not only the excess nitrogen that was accumulated during the dive, but make sure that CO2 levels return to normal. You'll end up feeling a lot better after your dive.